Hi, I'm Tammy and I have Joanne here to help me today. We're going to do a short video on verifying a blood transfusion. So I have a unit of packed red blood cells here, and a unit of packed red blood cells comes with a sheet of paper. It's like a small sheet of paper like this that's tagged right with the unit, and as well as that there's a piece of paper that comes with the unit of packed red blood cells or any blood transfusion that you would be giving, stating similar information to what's on the blood label. So you need two people to check the blood. This can be done away from the patient. Some nurses will do it at the med cart or around the desk somewhere. So this does not have to be part of being in the patient's room. One transfusionist has to be an RN. The second transfusionist can be, the second person checking can be an LPN, a graduate nurse, or a fourth-year student nurse. But the actual transfusionist infusing the blood has to be an RN. Okay, so I'm going to start here. The blood bag just came for blood transfusion services. It has to be hung within 30 minutes of being dispatched from blood transfusion services. So this is something that you need to be high alert for, watching for when it's brought to the unit. Okay, so I have one unit of O positive blood.
O positive.
And it's for Kim James.
Kim James.
And her MRN number is 014
014
290
290
920
920
03.
03.
And the MRNs are not that long in other PEI institutions. This one is just quite long. As well, I have a donor number. So the donor number is 521
521
719
719
911
911
3PC
3PC
02.
02.
So as you've seen, Joanne and I have said it very loud and clear. As well, you're going to verify the actual unit of blood, make sure there's no sediments or everything looks quite normal and healthy with the unit of blood. And then both Joanne and I are going to sign this piece of paper that have come with the unit of blood. So I'm signing my full name and my status as RN, and I'm also going to date it. And then I will have Joanne do the same. And the time as well, that's fine. Okay, so we have done the check. Okay, so those are the things. Again, you inspect the unit, state that it's a unit of packed red blood cells. You can also check the volume of the unit, which is around 400 mils for a unit of packed cells. The blood type, which is O positive, the name, the MRN, and the unit number. Okay, so now Joanne's going to come with me. We're going to actually go to the patient's bedside. Turning it around. Okay, so Joanne and I'll just move this back. So Joanne and I are now at the patient's bedside. So I'm going to get the patient to state her name. Can you state your name? And she'll say her name is Kim James. Now at this point, I'm going to check her armband against my sheet of paper that came with the unit of blood. So we have Kim James, MRN 014 290 290
290
920
920
03.
03.
So we have two people at the bedside, both identifying. Joanne's identifying versus this piece of paper. I'm identifying versus this piece of information that came with the unit. And two pieces of identification for the patient, both the MRN stated out loud and stating the person's name, because it has happened in the past that the wrong armband has gone on the wrong patient. So if you don't get them to state their name and or their birthday, if you want to do 3, that's perfectly fine, but it has to be a minimum of 2. Okay, so
Blood's checked.
Blood is checked. So I no longer need Joanne. So at that point, the second person can go away, unless you want them for company. So, but I'm sure she has things that she needs to do. So at this point, I would have already done hand hygiene. I'm going to apply a pair of gloves. I'm going to show you now the setups. Okay, so the first thing I have is just a basic primary line of normal saline. The normal saline should be at least 500 mils. I have a liter there, but it should be at least 500 mils, and I have it shut off. So it's only turned on if there's some kind of a reaction or to flush the line after the fact. So it's all clamped off, and that's my primary line. Okay, so then my actual blood setup is right here. You notice that it's a wide port, and so the first thing I did was I took a 50 or a 250. You really don't need any more than 250. That would be a waste, I think, above and beyond that. Some people use 50. The policy in PEI says a 50 ml bag suffices. A lot of RNs will grab the 250. You prime this line with, and there's a micron filter here, it's 170 to 240 micron filter. You prime it with saline first, prime it to the end with saline, and then you can shut this clamp off. And then at this point you can open this clamp, which is the side for the blood, and then prime the line fully with the blood. Okay? So then at this point you can attach it at the lowest port of your primary line. So you would chlorhexidine the port, and more importantly, let it dry for the appropriate dry time. Because again, chlorhexidine, if it doesn't dry, it's of no use. It didn't do what it was supposed to do. So we'll say for the purposes of this video, the dry time, it's dry. I will now attach the unit of blood to the lowest port. Okay, so it's attached to the lowest port, and then I would, often we transfuse it via a pump. The transfusion rate should not be any higher than 2 mils per minute for the first 15 minutes. Because if there's going to be a bad reaction, that's when it likely will occur early within the first 15 minutes. The vital signs, to talk about vital signs for a moment, the vital signs are very strict based on the institution. Some institutions will have varying numbers, but the key point is you have to take a full set of vitals before the transfusion is ever started within a certain time frame. Frequently during the transfusion, and again, each institution will line up what those are, and then post-transfusion. So for example, it might have to be done prior to the transfusion within a 60-minute time frame before the transfusion starts. Most people will take it immediately before. Within 15 minutes of the transfusion, every hour of the transfusion, and then post-transfusion. So it is quite often. The other thing is when you hook up the transfusion and start to run it, you should not leave the patient for the first 15 minutes. So you should pull in your computer or pull in whatever, pull up a chair and stay with that patient, not the hallway. You have to have eyes on the patient for the first 15 minutes because of the reaction that could occur. And the vital signs equipment that you do use should stay in the patient's room. You should use the same equipment throughout the whole transfusion, just for consistency, because sometimes a different sat monitor could read slightly different than another, so that equipment should stay at the patient's bedside for the whole transfusion. So that would be just a quick rundown of the blood transfusion, how to verify it, and how to hook it up and run it. Thanks.